Hello everyone, this is Sandeep Sharma here. So today I am here not to talk about any course, neither to talk about any topic in pediatrics. NEET-PG 2021 is only 5 months away, and through this video I'll be discussing certain small little points which I feel are important for you to plan your preparation over the next 5 months. Plus I'll be talking about some queries, some doubts and some myths which you must be encountering on a daily basis. So first of all, let me give a disclaimer that whatever I'll be telling is not something new. Most of these things you already know yourself, but knowing something and implementing something are totally two different things. They are totally separate things, and sometimes you need someone to tell you that yes, whatever you are thinking is right and you need to implement it, and it becomes all the bit easier to do it. So the first query which has been asked so many times and many of you might be encountering if you are active on social media is whether NEET-PG 2021 will happen or it will get postponed. Let me clarify, the NEET-PG 2021 will happen. See, COVID-19 scare, how it will play out in the next few months, we frankly do not know. But as of now, there is no reason to believe that NEET-PG will not happen. You need to understand that firstly, June exams of AIMS, PGI and JIPMER were not postponed, they were held. NEET-PG is a big exam. It also ensures that all the junior residents in medical colleges, the admission happens through NEET. In case the NEET-PG postponement or delay happens beyond a certain time, what will happen? It will compromise the residents reaching a medical college, and trust me, it is not the consultants but the residents who run a medical college. All the medical colleges in the country, their working will be compromised if NEET-PG gets delayed beyond a time. Having said that, I am not an astrologer and neither is anybody else. So what will happen a few months from now, we cannot predict. But as of today, just keep in your mind that NEET-PG will happen, and the tentative date for that is usually January 1st week. So prepare your preparation according to January 1st week. In case it does get delayed a bit, you can always it is always a welcome thing to happen in case you were running short on time. But do not think that it will get postponed or cancelled as some rumors are floating around. Stay away from rumors. All of you are doctors, you are smart enough, you should know what to trust and what not. Trust only the official notification. So this is the first thing. Secondly, a lot of people ask, sir, is there enough time? Yes, this is August 2020. From August 2022, first week of January, there is still 5 months to go. If you are focused enough, and even if you are starting from today, if you are a sincere student, there is enough time. The word important here is focused enough. You should be smart enough to know what all areas I am supposed to focus and what all areas I'll be revising. Now, how to go about it? Now, there are two things which can happen here. There are two things which you need to understand. If you are giving November, December Central Institute exams and are eligible for that, then you have to first prepare for those Central Institute exams, and between them and NEET-PG, you will have approximately 1 month. So your way of preparation, the blueprint will be slightly different. Whereas if you are targeting only NEET-PG 2020, then you have exclusive 5 months with you. So one complete reading plus 2 revisions are possible. Details of this blueprint I'll be discussing with you in a detailed video, which will be part 2 of this video. Now, what is must when you prepare for NEET-PG in the next 5 months? 3 things are must. Number 1, your notes. Proper reading and revision of your handwritten notes which you have made, not the handwritten printed notes I'm talking about, the notes which you have made irrespective of coaching institute, that is the most important thing, number 1. Number 2, recent papers. 3 recent papers of NEET-PG, 2 to 3 recent papers of AIMS, PGI, JIPMER. That is bare minimum. You can do more than that, excellent. If you can't do more than that, that is bare minimum. Every word, every MCQ mentioned there, you should be a master of it. And number 3, you should give at least 1 to 2 mock exams every month, so that you know whether the preparation you are doing, it is on the right track or not. Now, when you give mock exams, and many of you are giving mock exams, there are a lot of problems which arise. And now, first of all, when you give a mock exam, how would you assess yourself? Now, various teachers, various faculties have talked about it. I'll share my perspective. Suppose you give a mock exam of any coaching institute. You get a total score, not percentile, total score less than 50%. That means either your 19 subjects are not properly done or you are sincerely lacking in theory. So you need to read theory more, you need to work harder. If you are scoring between 50 to 65%, you are doing fine, but you need to increase accuracy. In that case, add recent papers to your preparation. And if you are scoring more than 65% as of August or September, you are doing excellent. Continue doing that to get that extra edge. Maybe you can add a few more older papers, give a few more subject-wise tests in areas which you feel are weaker, and you can always add the high yielding things like Harrison table, Nelson table, and the new drugs which are being asked. Now coming to when mock test is given, a lot of students ask me, sir, my score is increasing but my rank is decreasing, how to manage that? Score increasing, rank decreasing is a very common phenomena, and you must not pay much attention to that. What is more important is your score, not rank. Rank keeps on fluctuating. If your score is rising with each mock exam, you should be comfortable enough to know that you are on right track. Rank keeps on changing depending upon how many people were giving, and whether, suppose if I have joined, I've been taking coaching in a particular institute for last 4 years, pre-foundation, foundation, regular, and now app also. So obviously the questions which will be asked to me, they will have a familiarity of that particular institute. And if I give a mock exam, my score rate would be higher. The same does not hold true for other for actual exam also. So rather than chasing how many rank you are getting, if your score is on a rising trend, normally I say that every mock exam, if there is a gap of 1 month, your score should rise by 10%. If it is rising by 10%, you are on track. More than 10%, doing excellent. Less than 10%, you need to work harder. Having said that, you should also know that raising your score from 20 to 30% is easier, from 50 to 60% is tougher. So you need to assess yourself according to how the preparation is going, and remember, score is more important, the pattern of score is more important than the actual rank or absolute rank which you are getting. Now a lot of students again ask me, sir, my score has become static. I am giving exams but my score is not rising. What all I can do? If the score has become static in your preparation, there are 3 suggestions which I can do. Number 1, add recent papers to your preparation. Your score will rise. Number 2, increase the accuracy in your short topics. There are short topics which are always asked, like neonatal jaundice, neonatal resuscitation. I'm talking about pediatrics because that is my subject. Topics like vasculitis, connective tissue disorders, topic like GI blood supply, always asked. If you increase your score in those areas, focus on those areas or more, your score will increase. And third suggestion which I can give is work on the neglected areas. Everybody reads medicine a lot, surgery a lot, pharma, pathology a lot, and it is needed because they carry the maximum weightage. But end of the day, if examiner asks you half-life of ibalizumab, you may not know it. Nobody else would know it. So in subjects like pharmacology, surgery, medicine, a certain ceiling, a level is reached beyond which you cannot raise the score. If you need to raise the score, you need to work on areas where other people are not doing well. And there are 3 subjects which come to my mind. One, I call it as MOP, microbiology, ophthalmology, and my own subject, pediatrics. There are these 3 subjects. If you look at the last 2 or 3 NEET papers, you will find that approximately 40 to 45 questions are asked from these 3 subjects taken together. But mostly students, I find, I have been analyzing the trends for last many years, and I've seen that most of the good students also, they do not score more than 50 to 60% in these areas. In fact, microbiology and pediatrics are very scoring, and if you score heavily in them, your score rises much greater as compared to if you are targeting the shorter subject. See, every subject is important, whether big, medium or small. Even a single question can make or break your rank. But when you are preparing, your weightage of the allocation of time should be according to the weightage of the subject. So maximum time for medicine, surgery, followed by obs, gynae, pathology, pharmacology, followed by your middle level subjects which I told you, microbiology, ophthalmology, anatomy, pediatrics and orthopedics, and then you can talk about the shorter subjects along with ENT and physiology, etc. If you're targeting PGI, biochemistry becomes important. If you're targeting JIPMER, then physiology becomes important. NEET, everything is important. But again, time weightage is according to that. So identify, analyze yourself, what is the subject where I'm working, losing numbers, work on that. And trust me, many of you will find that micro, optha and pediatrics are the three subjects where you will lack. Not because you have not read them well, but because these subjects they are sometimes overlapping. Some people find them boring, and adopt these orphan subjects, MOP, micro, optha, pediatrics. If you are well in them, if you are thorough with them, you will score well. But end of the day, medicine, surgery, gynae, maximum weightage has to be given, because that will decide your bulk of the scoring. Now, other than this, a lot of people say, sir, I am into procrastination. I keep on, मैं चीज़ों को लटकाता रहता हूँ. I keep on postponing the things. See, it's like you are walking on a road and you find a 2,000 rupee note lying. What do? You say to yourself, okay, I will pick it up later. No, you just pick it up and put into your pocket if nobody else is watching, particularly if you are hungry and you don't have any money. So these topics like cephalosporins, classification of cephalosporin is always asked. Milestones, always asked. Biochemistry cycles, always asked. You keep them for the last, and what happens is, with 1 month to go, you have not done them before, thinking I will do it in the end. Trust me, if you have given the exam, you would know. Trying to remember cephalosporins or milestones in last week before the exam, you will not be able to do it, irrespective of how intelligent or how much is your IQ. So do them now. ये तो आना ही है. So why not do it just now and finish it off? Cephalosporins, 5 grades are there, 5 generations are there. All it takes is 5 minutes to do one generation. You may remember only 50% of it. Do it every week, make it a part of your working memory. Once you have understood, it will become so much easy because you have done it before. So focus, do not keep the important things for the end. Do them now. Be a master of the sure things now. It is a small good habit which will take you in a long way for your NEET-PG exam. Another small problem which many of you face is the thing known as FOMO. What is FOMO? Fear of missing out. Now you join a particular coaching institute or you join a certain app, you start feeling, okay, I have joined place A, but I have heard that place B notes are better, or teacher C is better than teacher D, and so on. And so while you are reading from one place, your focus is not on that place, but you start thinking about the things which you are missing out. That is known as FOMO. The primary reason for FOMO is excess screen time. It is excess exposure to social media. There is YouTube, there is Instagram, there is WhatsApp group, Telegram groups, and most of you are members of the individual pages and groups also. So there is a lot of information, lots of advertisement, lots of marketing, and lots of fake profiles also. Everybody knows it. So do not go by what people are saying. Let me tell you very frankly, no teacher, no coaching institute is absolutely good or bad. It all comes down to which coaching institute or which app or which teacher you have followed. If you have the notes made from them and you understand them, just be sincere, work hard on that, and make them a part of your working memory. Teacher या coaching place अच्छा या बुरा नहीं होता है. A lot of people have cracked their PG with top ranks even without coaching. One of them is talking to you right now. And other than that, after that, ironically, I came into this coaching thing, and last 6 years I have been taking classes. I have written blogs, I have written books, so I know a lot about it. End of the day, a teacher can only guide you. It is your self preparation, your hard work which will take you through. So take one source, anyone. कोई भी ऐप का, कोई भी बुक का, कोई भी गाइड का, just pick one, stick to it, do maximum revisions you can, and you will find 5 months from now, 6 months from now, when the results come, that whatever I said was actually true. Picking one app or one course and doing it sincerely 3 times is better than picking 3 apps and doing them once. So be a master of whatever you are doing. At the same time, be flexible to change your plans, to change your thing. If you find that a particular thing is not working well, give weightage according to time, and in the next 2.5 months, try to finish all 19 subjects once. Then every 15 to 20 days, one revision or one reading. It is doable. Those who will be able to do it, they will get great numbers in the exams. The detailed blueprint, if you are giving November Institute exams and not giving, I'll be discussing in a separate video. The purpose of this video was to share my perspective. All these queries have been asked to me on my page, on my social media, on the YouTube channel. I've got them on mails. So I thought maybe this video, even if it helps out even 10 people out of you, it would be worth it. There is no commercial interest here. I've not promoted anybody here. I've just said the things which I feel are right. So work hard. There is no substitute for hard work. If you work hard enough, smart enough, consistent enough, you will get through. Meet you in the second video. Thank you very much.